yes, are you comfortable? Before we begin, I have a few questions to ask you, if that's okay. Just for confirmation, you are here for a cranial nerve exam, correct? Okay, yeah, just making sure that you're in the right room and I'm not doing this exam on the wrong person. So, let's begin by asking you some very simple questions. Don't be nervous. They're questions that you should know the answer to. And after that, we will be moving on to the exam. What is a cranial nerve exam? Okay, well, to put it very simply, I'll be testing your 12 cranial nerves, which include some of your senses, motor skills, and reflexes. So, before you ask too much more, can I ask you some questions? Okay, great. So, can I get your name? Okay, yep, that is the same one that we have on file. So, you are the right person. And can I verify your date of birth? Okay, what year is that again? Okay, fantastic. Are you currently taking any medication? And what's that for? Okay. Have you been feeling okay generally? No cold or anything? No allergies? The seasons are changing, so... Okay. Were you feeling anything specific related to your senses or motor skills that caused you to take this exam today? Did something happen? Okay. Okay. Are you physically active? This can be something as simple as taking a daily walk, going to the gym, playing sports with friends for fun. Anything really counts as physical activity. Okay. Wonderful. Have you had this type of exam done before? I'm going to say no because you already... Okay. When was your last visit to the eye doctor? You're not sure? Okay. Do you wear glasses or contacts? Okay. Do you have any prior sensitivities to light? Maybe when you're driving, do the headlights of cars glare a bit too much? Do you have trouble driving at night? Do you have trouble with flashing lights? Okay. Do you have any allergies? Okay. Do you have any pre-existing hearing issues? Do you wear any hearing aids or... Okay. Alright, wonderful. So, the first thing I'm going to be doing today is just hearing your heart, okay? I'm gonna hear your heartbeat for a quick moment and then move on to your lungs before we get into the main portion of the exam, okay? Alright, so just breathe as normal, okay? Breathe as normal. Okay. Alright, now can you take a deep breath in for me? Exhale. Another deep breath in. Exhale. Another deep breath in. Exhale. And one last time, deep breath in. Exhale. Very good. Alright. Both of those sound normal. Now, can you just, this is going to sound a bit funny, But can you just stick your hand out like this for me? Yep, just like that. Like an ET phone home moment. And can you just tap, tap, tap your finger to the edge of my pen, okay? Just meet it like this. Can you do that for me? Good. Again. Good. Again. Good. Again. Good. Again. Very good. Now I'm going to cover one of your eyes. I'm going to have you do the exact same test, okay? Alright. Okay, so can you just tap the end of the pen for me? Good. Again. Good. Again. Good. Alright, now this other side. Tap it for me. Good. Again. Good. Again. Good. Again. Good. Fantastic. So, I'm just going to feel along your face, okay? And tell me if you experience any irritation. Have you struggled with a stuffy nose or anything lately? Any congestion? Okay. You don't feel any irritation when I press there, do you? I'm just pressing right below your cheek and along your nose bridge. Sometimes there can be a buildup of fluid right here, especially around this time of year. Okay. Alright, and I'm going to feel right there, this portion of your neck, to feel for any swelling. Okay, I don't feel any swelling. Alright, that is very good. Now, I'm just going to put some of this liquid in your eye, okay? And all this is going to do is make it so I can see your pupils. I bet he's sorry, not your pupils. I always say pupils, but it's not your pupils. I'm just going to put this right into your eyes and make sure that they're properly dilated. That way I can accurately see where you are looking, okay? My apologies, your pupil is inside your eye. There we go, and the other side. Blink, 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 blink. Blink, 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 blink. Very good. Blink, 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 blink. Very good. Okay. So, now, just follow the light for me, okay? This light is pretty bright, so bear with me, okay? Just follow the light for me. Good. Keep following it. Just going to peek around here. Keep following the light for me. Very good. Is it hard to focus? Okay. Keep following the light for me. Okay. Yep. Keep following it. Okay. Can you take one of your hands and cover one of your eyes? Great. Now follow the light with this eye. Okay, good. Now, can you cover with the other eye? Thank you. feel down your eye just for a moment there and take a peek in. Okay, now the other side. Okay, very good. Can you tell me when this pen leaves your field of view, okay? Do not move your head. Okay, great. Okay, great. Again. Fantastic. Okay, now I'm going to cover one of your eyes for you. That way you really don't move your head. And tell me when it leaves your field of view, okay? Good. Good. Great. Once again, going to do the same thing. Good. Good. Great. Alright. So, let me make a few notes for this side. Okay. And one last test. Can you tell me what color this is? Okay, good. What about this color? Good. What about this color? What would you say this one is? Okay, very good. Can you tell me what color this liquid is? Very good. Can you tell me what color this is? What color is this? Very good. What color is this? Very good. Alright. Okay, now, can you follow the blue pen for me? And when I tell you to switch, you're going to follow the white pen, okay? Alright, so follow the blue pen. Just with your eyes. Do not move your head, please. Thank you. Okay, now switch. Good. Switch again. Switch. 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 Very good. Okay, so that was to see how well you have been able to switch tasks easily with your ocular mobilities, if that makes any sense at all. I'm not really sure if it does, to be quite honest with you, but it's what we do here. Okay, so now I'm going to test your sense of smell. So I would like you to close your eyes for me, and I would like you to tell me what this scent smells like. Pine trees. Very good. Now I have this pad to put right under your nose. You're just going to sniff like that, okay? On this side, obviously. Take a sniff. That should cleanse your palate for this other scent, okay? So keep those eyes closed and ready. What did that smell like? Vanilla. Very good. Yeah, so we go for very basic scents. We find that the easier they are to recognize, the less burdensome it is for our patients. Okay. Now, I may be doing something that you might not find as comfortable. So my apologies up until now. It has been very, I would say, calming. Unless you don't like the scent of pine or vanilla. Can you do me a favor and open your mouth for me very quickly? now, close your eyes once more, although you can't visually really tell what this tastes like. I have a specific taste that I want you to be able to reiterate back to me, and it's only one taste. Do not worry, but this is why I had to ask you if you had any allergies. So, this is our most popular flavor, and if you're able to tell me this one, then you're good with the taste, okay? Okay. It's a strong flavor that most people taste at least once a day if they're... I can't give you any words. It's mint, yeah. If they're hygienic, I was going to say, if you like brush your teeth with toothpaste, pretty minty usually. But obviously if you have toothpaste that's not mint, that doesn't really apply now, does it? Okay, so now let's move on to testing your sense of touch, okay? So I am going to use this soft blanket and just wipe it on parts of your face, okay? And this will be the soft feeling, so this is what soft feels like, okay? Okay, did you feel that? Okay. And this is going to be the sharp feeling. I'm going to use the end of my pen, okay? Just... Alright, that's what sharp feels like. Okay, ready? Close your eyes and tell me whether or not you feel the dull or soft. Being the same thing, dull, soft, right? Versus the sharp feeling, okay? Alright, ready? Close those eyes. That was soft. Sharp. Soft, good. Sharp. Sharp. Soft. Soft. I'm going to roll up your sleeves a little bit for a moment. Tell me whether or not you feel the sharp sensation or the dull sensation. Soft, good. Sharp, good. Sharp, good. Soft. Very good. Okay. This test is one that doesn't have to be too long. You get the gist of things, but can you just tell me if you feel the cool or warm sensation now, okay? So, my hand without the glove is going to be the warm sensation, so you can be feeling my hands for a very brief moment. And the glove is going to be the cool sensation, okay? Ready? Keep those eyes closed. Warm, good. Cool, good. Cool, good. Cool, good. Warm, good. Warm, good. Warm, good. Cool. Very good. Right. And now, let's test your hearing, okay? So, you've been hearing me well throughout this exam. Yes, I mean, I think so. You've been following directions well. I feel like we've been having decent conversation. So, I am pretty confident that you can hear decently well or at least your body has become accustomed to how you hear, I'm going to be whispering a word in your ear, and you're going to tell me what it is that I'm whispering to you, okay? Okay, ready? Cactus. 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 Good. Good morning. Good morning. That was good morning. Good. 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 That was good. Let me think of a word. There's no specific words that we have to say for this part, so. YouTube. Very good. Yeah, I feel like most people know what YouTube is at this point. Oh, I have one last one. Google. Google. Now I'm just having fun with it, to be honest. Okay, yeah. So I feel like you hear everything pretty well. Now, one last hearing test. I'm going to click my pen in various locations, being left or right side, and I need you to tell me whether or not you hear from the left or the right side, okay? Okay, ready? Good. Again. Good. Again. Good. Again. Good. Again. Great. Okay. Oh, wait. One last time. Up or down? Tell me. Okay. Good. Good. All right. Very nice. Very well done. All right. So, we're getting to the final moments of the exam. But luckily, everything's been going fantastic. So, I need you to take your hands, and just lay them flat like this. And I need you to tell me when you feel my hand go into yours. Okay, ready? Good. Again. Good. Again. Good. Again. Okay, fantastic. So, I need you to hold your arms out like this. And I'm going to try and push your arms up. You're going to fight me on it and try to push your arms down, okay? Yeah, this is testing your motor skills. Okay, ready? Good. Okay, now the opposite. I'm going to be pushing it down. You push up, okay? Very good. And now the same thing, out and in. Yep, just push out. Good. Right now, push in. Good. Very nice. Okay. That is done. So, are you a pretty mobile person, you'd say? Okay. I'm going to drop my pen on the floor and you're going to pick it up for me. I know it sounds like a grueling task, but it's just to test that you can go to the ground and then pick stuff up by yourself, okay? Okay, ready? Can you pick it up for me? Alright, do you know if you can do that without touching your knee? Okay, let's try one more time, okay? Okay, thank you. Alright, so thank you for getting my pen, and thank you for being here today, coming in. So, luckily you passed with flying colors. I have no negative things to say. I wish you all the best. I will send the results of this exam along to your primary physician, and I hope that anything that you've been struggling with gets resolved. I'm so glad I could help you today. Yes, it was nice to meet you.